United Nations Convention on the Rights of the Child.
In some of our pastoral communities, the girl child has been denied education due to early forced marriages. The government and other development partners have been at the forefront in ensuring that there is gender equity in access to education. Model schools that are safe havens for girls rescued from forced marriages have been established in these areas. Over the past few years, Kenya has made many strides in empowering women in many aspects. Today, many women occupy key decision-making positions both in leadership and development activities. There are 15 women MPs and dozens of others in high-ranking positions.
There is a focus on gender. In all the projects that we are implementing and around the country, all the committees that are set up, it is our duty to ensure that there is inclusion of both genders and that there is at least 1/3 women in all the committees we set up. We have not attained this fully, but we are trying to do our best to ensure that even within the country, and for the first time, gender issues are being addressed across the board. And as you have noticed in this government, there is more women than has ever been. There are more women in Parliament. That doesn't mean we have made it on the issue of gender, but it means at least there is some forward movement.
This is a good demonstration of gender equity. However, more needs to be done, especially by giving equal opportunities in schools and institutions of higher learning as demonstration of gender equity. Provision of quality healthcare services to the population is one of the key priorities of the Kenyan government. This is to ensure that maternal health, which is one of the Millenium goals, is achieved. With the disbursement of constituency development funds, more health centers have been established, enabling mothers and children access healthcare services closer to where they live.
We have already disbursed 265 million shillings to all the districts in Kenya. We have put more than 14,000 Kenyans on antiretroviral treatment, and this brings the number to 44,000 people on ARVs today. This is up from 2,000 in the year 2003. Today we are happy to say that we have 44,000 people on treatment.
Provision of mosquito-treated nets is one of the key interventions in rolling back malaria. Malaria has been responsible for the increase in child mortality rates in the country, hence the government's deliberate efforts in combating the scourge.
The board of the Global Fund has approved Kenya shillings 16.5 billion for funding programs of malaria in Kenya. This is addition to Kenya shillings 10 billion for HIV/AIDS programs and another 1 billion shillings for tuberculosis prevention and control activities. This therefore makes the Global Fund the leading sources of additional funding for Kenya's fight against the 3 killer diseases, HIV, AIDS, TB, and malaria.
It is now my great pleasure to launch the Global Fund Financed Malaria Program in Kenya.
Kenya's forest cover account for only 1% against the recommended 10% cover. This has been occasioned largely through human encroachment for settlement, excision of forests, logging and charcoal burning, a serious challenge to environmental sustainability. This is a trend that has attracted the government's attention, and already a forest bill has been passed by Parliament, which will ensure the conservation and proper management of our environment for posterity.
My ministry has carried out extensive research on suitable tree species for this ecological zone, and a selection is now available for planting in the areas, including the suitable technology transfer to combat desertification.
Partnerships have been developed with international and local agencies. Communities are getting empowered and are seriously involved in the tree planting exercises and other environmental conservation measures. Our own celebrated Nobel laureate, Professor Wangari Maathai, an assistant minister in the government, has been in the forefront in conservation campaign.
kufungua misitu